My name is James Flanders, and I had to see a doctor because of pain in my shoulder and not being able to lift my arm above my head. And he had to do a complete shoulder replacement.
Jim came to me with chronic right shoulder pain that he actually can remember injuring his shoulder over a decade prior to him presenting to me. He had pain for that long of a period of time. And it had progressively worsened over the last few years, really to the point where he had extreme difficulty sleeping at night. He had problems with activities of daily living. He was really miserable from this. We took a look at him. His physical exam was very concerning for a very large rotator cuff tear. And so we got an MRI of his shoulder, and he had a massive rotator cuff tear that was quite old. Probably over a decade. The tendons were retracted back medial to the glenoid, and there was significant muscle atrophy and fatty infiltration of the rotator cuff. Now, what does all that mean? So the rotator cuff is a set of 4 muscles that help hold the ball in place. The shoulder is a ball in a socket, and there's 4 muscles. There's one in the front, one on top, and 2 in the back of your shoulder blade. And when the tendon, which attaches over here on the humeral head, tears, the muscle, which is not working because it's not attached, starts to atrophy and get smaller, and that pulls the tendon this way. So that had been going on for quite some time, and he started to develop a condition called rotator cuff tear arthropathy. And what happens is, when the cuff has been torn for a long period of time, the humeral head, the ball, starts to ride upwards like this, and it starts to wear on the undersurface of the acromion, which is this bone you can feel on top of your shoulder. And it also starts to wear out the top of the glenoid, or the cup. And that's where Jim was. He had a very large rotator cuff tear that had been there for a long time, and given everything that I could see on the MRI, the rotator cuff was not repairable. And then he had started to develop arthritis of the rotator cuff tear, rotator cuff tear arthropathy.
He put the ball where the joint goes and the joint where the ball goes, and it created a situation to where that I listened to my therapist and I listened to Dr. Farrell, and I can go from here to here now. And before I might have been able to lift it at a 45-degree angle at the most. How things have improved is that I can do things that I couldn't do before. I can actually physically do more with weed eating and everything like that, and I'm more able to withstand, and I don't have the pain. I would recommend him, especially if it's shoulder, because he's a fantastic doctor. He has a good bedside manner, as they call it. He does tell you, he explains things to you to a point where that you understand them, and in a language that you understand them.
So we discussed treatment options. Jim just wanted his shoulder fixed. He wanted to have one operation and then be done with it. So the best operation for him, given all these circumstances, is called a reverse total shoulder. Now what that is it's different from a standard total shoulder, where if someone has wear and tear arthritis, you put a new ball on the ball side and you put a new socket on the socket side, just like any other total joint, total hip, total knee. In this setting, we have to do a special kind of shoulder replacement that makes up for the deficiency or the absence of a rotator cuff. And so in that case, we reverse things, and we put the socket on the ball side and we put the ball on the socket side. And so this is a model of what that looks like. And so if you recall, this is where the socket was on the glenoid, the scapula. And so now we have the ball on that side, and here's the socket on the opposite side. And so that works amazingly well. The stability now is from the implant. It's not from the rotator cuff, which is not present. And these folks do very, very well under the right indications. And Jim has done wonderfully with his reverse total shoulder.